Have you ever watched your child and thought, hang on, is this ADHD, is this autism, or is this something else entirely? If you have, you are absolutely not alone, because so many parents sit with that question quietly for months. It often starts with little things like not listening, constant movement, sensory struggles, big emotions, or social differences. And the reason it feels confusing is that ADHD and autism can overlap in ways that look surprisingly similar at first. Both can affect attention, behavior, the emotions, and how a child copes with everyday life. But they are not the same thing, and there are certain patterns parents often notice early. So in this video, I'm going to walk you through 5 key differences parents often spot first. Before we dive in, I need to say something really important from the beginning, and I hope it's not taken wrongly. This is not about diagnosing your child at home from a YouTube video or reaching any type of conclusions. It's about noticing patterns that may help you decide whether an assessment is worth exploring. And this framing and everything I talk about is very much in line with NICE CKS and NHS guidance from the UK. Because both ADHD and autism assessments are based on a wider developmental picture, not one isolated behavior. And some children do in fact have both, which makes the picture even more mixed and difficult to diagnose. So what we are really doing here is learning how to observe more peer, not labor to quit it. One of the first differences that often shows up and parents come to me with is a child who seems not to listen. With ADHD, that child may genuinely want to listen, but their attention keeps darting somewhere else. If they hear part of what you say, then a noise, a toy, a thought, or movement pulls them away. While with autism, the issue may be less about directing attention and more about social communication differences. So what might be happening is that they hear you perfectly well, but respond differently to the interaction itself. In other words, one child may be distracted, while another may be processing the social moment differently. And that difference matters, because on the surface, both can simply look like not listening. The second difference that parents usually pick up shows up in the overall style of a child's behavior. With ADHD, children are often on the go, impulsive, fast-moving, and constantly switching between activities. They may climb first, grab first, interrupt first, and only think about the consequences afterwards. With autism, parents may be more likely to notice repetitive behaviors or a strong need for sameness. These might be wanting the same routine, the same cup, the same route, or the same order every day. So what you may notice is that one child can feel unpredictable and constantly shifting, and another may feel much more predictable, but very unsettled when that predictability disappears. The third difference often appears in the moments parents find hardest, big reactions and meltdowns. With ADHD, the explosion is often linked to impulsivity, frustration, and difficulty pausing or reacting. As we reamped earlier, it can look like shouting, grabbing, storming off, or reacting before thinking. With autism, the reaction may be more about overwhelm, especially sensory overload, uncertainty, or unexpected change. So the outside behavior may look similar, but the reason underneath may be very different. Like before, one child may be acting before their brakes click in, so they don't realize they need to stop what they're doing. And another may be reacting because the world suddenly feels far too loud, chaotic, or intense. The fourth difference often becomes clearer once children are around other children more regularly. A child with ADHD may be very social, but struggle to wait, take turns, or stop interrupting. They may dive into play beautifully, but then derail the game 5 seconds later without any intentions of doing so. Whereas a child with autism may want connection to, but struggle more with reading social cues or social rules. They may not easily pick up what another child meant, wanted, or expected. So what we see is that one child may rush into social situations too fast, and another may hang back, misunderstand the flow, or find social play genuinely confusing. The fifth difference parents often notice first is what seems to trigger the behavior. With ADHD, distraction often comes from anything new, interesting, exciting, or immediately rewarding. So they may leave the table because something else suddenly caught their attention. With autism, parents may notice much clearer patterns around noise, textures, clothing, food, or change. So a child may refuse socks, cover their ears, avoid certain foods, or become distressed in busy places. So essentially, we usually see that one child is pulled by what is interesting or shiny or new, and the other may be pushed away by what feels overwhelming to their senses.
Oh, that's wonderful news. We should definitely celebrate soon.
Now brace yourselves. Here's the part I really want all parents watching this to take away from today. If these patterns feel familiar, it does not automatically mean your child has ADHD or autism, but it may mean your child would benefit from a proper developmental assessment. And according to NICE CKS, symptoms should be looked at for settings and over time, larin isolation. So think about playing, nursery, school, friendships, routines, and how your child manages daily life. The best next step is usually speaking to your GP, health visitor, school, or nursery with specific examples. Not just he seems hyper, but things like he cannot stay with one task, or she struggles badly with changes. That kind of detail is far more useful than a label guessed too early. A diagnosis of such as has long-term effects on children's lives. So let's put it all together and recap this as simply as possible so we get everything straight. With ADHD, parents often notice attention drifting, impulsive behavior, and constant movement. With autism, parents often notice differences in social communication, sensory patterns, and a need for sameness. But, because nothing in science is ever simple, the overlap is real, and some children have both. So if you have been confused by your child's behavior, that confusion makes complete sense. Many parents feel it's their job to work this out, but it's not. Us professionals find it hard, so I can imagine how anyone else feels. Your job is simply to notice patterns, trust what you are seeing, and ask for help when needed. You're doing great just by taking time out to watch this video and educate yourself further for your child. That's good parenting like that.